In coronavirus coverage tonight, Novavax booster vaccines are now available throughout Virginia. The federal government signed off on the shots last week. The doses are authorized for residents 18 and older who could not take another vaccine brand because of medical or accessibility issues. And flu season is here, and health officials are worried of a potential triple-demic. Can't believe that's a word, right? So that's a period where people could be at risk of contracting 3 different viruses. Our Katie Ree is in the studio with the latest.
Good evening. Now, we saw this during the height of the COVID pandemic. Masking helped to stop the spread of the virus. Now, there was a decline in flu cases at that same time, but now with the risk of 3 surging viruses, could this mean a return to masking? That question got mixed reactions today.
Too many strands and viruses are popping up, and got to stay safe.
Data from the CDC is showing a rise in flu and COVID cases, along with respiratory syncytial virus, also known as RSV, which is most common in young children. The surge is not only in the DMV, but across the nation. Now, health experts at the American Medical Association are warning of what they're calling a triple-demic. But could this mean a return to masking? Local health officials say not just yet.
We haven't gotten to that bridge. We still continue to use data analysis and assess what the science is guiding us on. There isn't been an impetus to return to an indoor mask mandate.
Health officials in Montgomery County say they're focusing on other tactics to stop the spread.
The most effective mechanism to prevent the spread is vaccination. Any decision by the health team to recommend masks, again, to the county council, that would be a far down pathway that we would consider.
Some community members I spoke to say they'd welcome a return to masking.
The mask mandate isn't fun, but I know it does help people around, so I don't mind.
I think wearing masks is a low-level, easy thing to do, minor inconvenience, and everyone should think about doing it. I have my mask in my pocket. I already have my flu vaccine. I already have my Omicron booster. And if there was something to take for RSV, if I was a little kid, I would do that too.
While others aren't as keen.
I don't feel like we need to mask back up. I've been vaccinated 5 times plus a flu shot. Talked to all the experts, that should be enough. And I don't think most masks don't work anyway, so.
Health officials are recommending you get both your COVID booster and flu shot at the same time, and to look out for wheezing or coughing, a fever, and a decrease in appetite in children, as those are some of the symptoms of RSV. For now, DC News Now, I'm Katie Ree. Back to you.